Alors, bienvenue à tous. Bienvenue.
So welcome everyone. Welcome to the Evelyn Zuma room for the update on the situation of the coronavirus in Quebec with the Premier of Quebec, François Legault. He's together today with the Minister for Education and Higher Education, Jean-François Roberge, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Thank you. Hello, everyone. As we said yesterday, since yesterday, we have accelerated the number of screening tests, so it is normal that the number of cases is increasing. We even expect that the biggest increase will arrive tomorrow because the test results will be coming in tomorrow. So the numbers for the past day, 219 cases of people infected, so an increase of 38. 24 people being hospitalized, that is an increase of 5. 13 in intensive care, so an increase of 3. Good news, no new deaths. Even yesterday, in the 5 deaths that we mentioned, there is one person that had been tested for the coronavirus, so we had taken it for granted that it was somebody who had died of the coronavirus, but the test arrived and it was negative, so we are now at 4 deaths, no longer 5. And all 4 deaths are in the same residence for the elderly. So I think that it's important to be transparent. I think that what this shows, since all 4 deaths are in the same residence for the elderly, it shows the importance. I know that there are people who are finding this hard, but unless there is a humanitarian situation, somebody who is in palliative care, you must not visit places where the elderly dwell. It's also important that people who are in those residences do not go out uselessly in case they would bring back the virus to the residence or the nursing home. Considering the number of tests, we have 2,000 people awaiting for results right now, 9,700 who have received a negative result. I wish to bring a point of clarification after a few articles that have been published on the number of tests. First, when you're taking into account the population, so keeping all proportions in mind, up until now we have done more screening tests in Quebec than, for example, what the United States have done or France. When we compare ourselves to the other Canadian provinces, per capita, we have about the same number of tests as Ontario, but there are 2 provinces that have done a lot more testing for specific reasons. British Columbia, who has the neighbor, that is Washington State, where there's been a lot of elderly people and where there's been a lot of deaths also in British Columbia, as well as Alberta, who has taken an approach that is different from ours. We have chosen that up until now, we are concentrating on those people who have traveled and have symptoms, as well as the medical staff. Alberta is going with another strategy. But all proportions being kept, if we compare ourselves to the rest of the world, we can count ourselves lucky. We've done a lot of screening tests, taking into account the stage where we're at in the progression of the virus. So the measures that we've taken in the past 10 days are going to be felt. They do have an impact. That is what public health is telling us. But we believe that at this stage, we have to go a little bit further. We have to intensify our measures. So this morning, together with public health, we have agreed to announce that as of midnight tonight until the 1st of May, all shopping malls are going to have to close down except food stores, pharmacies, and the SAQ. I want to be quite clear. Stores that have an external door or a door that opens to the outside are going to be able to remain open like any other store. But when you have to go through a shopping mall to go to that store, we want to limit ourselves to those 3 categories only to limit things. Right now, there are still too many people in shopping malls, so we want to act upon that. We also wish, for the same period of time, so as of midnight tonight until the 1st of May, we want to also close down any restaurant rooms. We had already said that you can keep rooms open at 50% of their capacity, But now we believe that we have to intensify our measures and totally close down restaurants, keeping only services for takeout. We encourage restaurants that are not doing so to do it because of course, we do have to continue feeding the population. I've also seen a lot of comments in the course of the past few days on hair care salon. It's difficult because it's almost impossible to respect the standard from 1 to 2 meters. So we're going to be asking any hair and other grooming stores to close down. So all those measures are to slow down the spread of the virus. Now, I have with me the Minister for Education. We want to talk to you about schools, CEGEPs, universities, daycare services. We had told you at the end of March, so we're confirming today that all of those establishments are going to be closed until the 1st of May. In the course of the next few weeks, however, the Ministry of Education is going to be sending out lists of work that can be done by the parents to help children to continue with some of the learning. And Jean-François is also working together with Télé-Québec to set up spots for children. But I want to reassure everyone, regardless, we believe that the vast majority of children will be able to get to the next level, and there will not be any ministry examinations this year. That is already decided. As far as CEGEPs and university, there are already establishments that offer online courses, and we're going to make sure at the Ministry of Education that it is a case for all CEGEPs and universities so that students be able to finish their school year. Now, for daycare services, we're looking at the present situation and keeping it until the 1st of May. That is to say, they're all closed, except for those services offered to the parents of healthcare staff. And I want to take this opportunity to once again give a very profoundly felt thank you from the heart for the educators who are working in that service. You are taking care of our guardian angels, and so you are yourselves guardian angels. Now, for all the staff, this is a request, and I'm including the education and daycare center staff who are not working right now. I would ask you to go and help community organizations. I was saying it yesterday, a lot of community organizations could count on volunteers who are 70 and over to whom we've asked to stay home. So if it's possible for you to go help those organizations and also to help, generally speaking, and this is a message that is given to everybody, people 70 and over. There are grocery stores that have delays for 1 week for the delivery of foodstuff. So please go and help out your neighbors, your family. It's important that people 70 and over be able to receive food. We still have to be careful, remain 2 meters away from the person, but it is possible to do it in a very safe way. Another message. This one for anybody who has symptoms and need to go get care. Please, tell the truth. We've had cases where people have hidden the truth because they were scared to not be cared for. You can be cared for regardless, and you will avoid the transmission of the virus to the healthcare staff, which is the last thing that we want. Don't put anybody's lives in danger. Tell the truth to the healthcare staff. This is serious and has to be said. Another word on critical equipment. A lot of things being said around the world on the masks, on ventilators, material to be able to do the screening test. We are fine for the upcoming weeks. Of course, in all transparency, for what will be coming up, we are counting on orders, and we're not taking any chances. We've already asked about 15 different Quebec companies to be able to work, just in case, in the fabrication of some of that equipment. And we're also working very hard with the federal government. I have to say the federal government has managed to place orders for all of Canada and to be able to hand them out to the different provinces. So it's really important to continue working with the federal government. Now, good news for Hydro-Quebec. Hydro-Quebec, to give a respite to Quebecers that are going to go through financial difficulties, is not going to have any penalties for bills that are paid late until it stops, until we ask them to stop. One last point concerning the police officers. I continue being very satisfied with people's respect of the guidelines in the vast majority of cases. There's been a few isolated cases where police officers have had to intervene. What we've also asked police officers is to have vigilance and inform people who are not yet informed. We don't want to go with repression once again. I continue counting on the collaboration of all Quebecers. So I would like to end by saying what I pretty much say every day. Every gesture that we pose right now to reduce the number of physical contacts is going to allow us to limit contagion and the spread and save lives. And the faster we all do this is what we wish, the faster 100% of Quebecers will follow these guidelines, the more lives will save. So talk with your neighbors, talk with your friends, talk to the people that you see who don't respect those guidelines. It's important to respect them. And upon these words, as I was saying yesterday, I am proud and I want to thank you for your collaboration. Thanks to this collaboration, we'll succeed together. Thank you. We will now go with the question period with Louis Lacroix. Hello, gentlemen. Mr. Legault, yesterday you hid something from us. You did not say that in the decree that you adopted on Friday evening, gatherings outside and inside were forbidden. Why not have informed people yesterday? There were many people yesterday who were surprised to see, for example, in Quebec, the arrival of police officers who came to tell them that they could not get together. During the press conference yesterday, there was never any question of forbidden internal and external gatherings. Okay, well, first and foremost, this is not new. We've been saying it for a number of days that we were forbidden gatherings. Now, what I said yesterday and what I'm repeating today is that I do not wish, except in the case of exceptions, that the police has to intervene. I am counting the collaboration of Quebecers. That is what I said yesterday. That's what I'm saying today. Yes, the decree allows us to have the law applied by police officers, but we don't have the intention, except in exceptional cases, to use that. And that's what I said yesterday. That's what I'm saying today.
Merci. Patrice Bergeron, La Presse canadienne. Question pour les parents, en fait.
A question for parents who are wondering if they have to teach at home. A lot of them would like to be able to get material that is still in the schools. Would that be possible for them? I want to specify one thing. We don't want to transform every single parent of Quebec into teachers and transform every single home in schools. We are in a perspective of healthcare and public health right now, taking care of people. We want to ease the life of families. We want to complicate the lives of people who are already in quarantine, who sometimes have to work from home, as well as take care of their children. So we have 3 phases. We had a 2-week period where we said it's closed until the 27th of March. As of the 30th of March, the government of Quebec, that is my ministry, will set up a site online with all sorts of stimulating and learning activities that are going to be optional, non-mandatory, but enriching, stimulating, and interesting. And they will be easily accessible. As of the 6th of April, the week of the 6th of April, there will be, to every family, every student will get a list of activities, weekly activities, and these will be suggestions. Once again, they won't be mandatory, but they will be adapted to the age and level of the child. So you have a child who's in grade 2 and another one who's in secondary 3. It will be 2 different lists. So interesting, stimulating activities. If you can do it by email, great. If there are places where there aren't, it's far, it will be done by snail mail. So we'll find a way of being able to join everyone. Now you've asked me the question on going to the school to get material. We did talk about that this morning. We will be allowing it as of next week, but it is something that is going to be coordinated with a lot of prudence in order to avoid gatherings. It will be monitored by the service center and the school. It'll be upon invitation, and we're going to prioritize the children who have difficulties at school for whom it is more critical to get their material, either the book or the pad or computer. But that is something that we are going to be thinking about while respecting, of course, the guidelines of public health. So I'm telling you, don't go to school tomorrow. Don't anybody go to the schools unless you are invited to do so. My question has to do with the contingency plan for critical care concerning COVID-19. The plan has 4 different levels. The information indicates to us that, or 4 levels of alert, and our information tells us that we're at level 2. What happens at levels 3 and 4? What is planned for? Well, there's an increase of certain activities, and other activities are let aside. We are in anticipation. Even this week, we'll have an ability to treat patients as such. If it starts going quickly, we've already freed up a lot of beds. And even, I'm going to tell you, in relation to previous plans, we are much more into anticipation because we know that once it comes, it'll be very quick. So as a general principle, there are phases, different phases. There's even a rehabilitation stage. But what we're doing is that we're taking the measures, we're analyzing the situation from one day to the next, and we try to be in the ulterior phase in preparation. For example, right now, we already have freed up a capacity of beds, whereas we could have waited. We used to wait, to have signs that that things were coming up. But now we have reorganized everything, and if you allow me as well, we have already planned for the worst of scenarios if we had to increase beds even more and take back parts of hospitals, or to even build hotels as hospital for patients who would need care but not as intensive. We could transform usual rooms into intensive care rooms because we would add respirators or ventilators. We can transform an ordinary room. And that's what people need in those situations, oxygen and a ventilator. So it's not the same mechanism. So we could open new wings. And that is the idea. And if you allow me, I would like to pass a message. It is very clear. The Premier and myself, we've told you that we have to avoid physical contacts between people. We have to keep distance between one another. If we stop shopping malls or restaurants, because there were still people and the elderly would get there to have a coffee, etc., from different families, don't go to somebody's home now and keep the same contact. We have to be careful. We can't transfer. For me, a gathering, when you all live and you've been living together for a long time, okay, you're together. But as soon as you introduce somebody from the outside, and that's going on, don't displace the problem from one area to send it elsewhere. So the best message is still stay at home. Go out to get some fresh air. Go out to go get the things that you need. But it's not time to get together. I'm telling you because we can't go to the shopping mall anymore. Well, let's go to so-and-so's. Don't do that. We can't do that. Hello, gentlemen. Just a point of clarification. There still only is one person who's been cured of the disease in Quebec? I think that there's more than that, I believe, but according to the strict criteria of having 2 negative tests, to my knowledge, yes. And they're probably cured, but it's because of the 2 tests. But just very quickly, it is very probable that after a certain amount of time, when the person goes much better, we're not going to do the second test because we have to keep the test for the right things.
Tommy Chouinard, La Presse.
Bonjour. Bon, au sujet des écoles.
About the schools, should we understand, because this is a list of work that's optional, and the ministry exams have been cancelled. So we understand that basically everybody is going to get a diploma. In secondary 5, people are going to get a diploma at the end of their high school studies. Is that what we have to understand? Everybody's going to be sent to the next level? What, next year? First, it is possible that we'll open the schools on the 4th of May. That's not excluded. We're announcing now that we are closing until the 1st of May. Possibly in April, we'll decide whether we can open up our schools again or not. But if we were to not open our schools, On the 4th of May, we will be asking teachers to take into account the previous evaluations. 2/3 of the year was done. Over between 65 to 70% of the school days had already been done. So there's enough evaluation that's been done. So right now, the teachers have already sent 2 bulletins to their parents. So a student that might have had a lot of difficulty in the year won't necessarily magically be sent to the following year. But there's been 2 school reports sent already. So a lot of people have been tested who are waiting for the results, and they've been waiting now for a week. How can we explain these delays, and what are you telling people who are waiting at home in anxiety to get the results? Well, I asked a question again this morning, and I think that tomorrow, and that I think that the number of cases will increase tomorrow. As of tomorrow, it'll be a maximum of 2 days before getting a result. So you're telling people, well, there are certain cases, it depends on the region, but there are certain regions where perhaps there are people who have been waiting for over 2 days. But as of tomorrow, it should be no more than 2 days.
Monsieur Legault, pouvez-vous nous dire qu'est-ce qui...
Monsieur Legault, could you tell us what is the extent of the powers of police officers in this ban in gatherings? Up to how much can they do? What is the scope? I know that you're saying that it's theoretical, but if you passed a decree that allows it, I think that Quebecers have the right to know what they are exposing themselves to if ever they don't follow those rules. Well, essentially, what we can say is what we can ban together with police officers any gathering. We can force somebody, for example, who has tested positive to stay home and isolate themselves. So the rules that were fixed by Dr. Arruda for the past week are rules. And those rules, if necessary, will be forcibly applied by police officers. But we're not there yet, and I really don't wish that we get there, except in exceptional cases. Along the same vein, there's been situations in Montreal that are a little bit complicated. There are police officers who are calling out to people who are homeless, but say that they cannot force them to be tested or taken care of. And those people are a lot in the street. They have symptoms. What should we do? Police officers are asking for clear guidelines here. They will be receiving them. It has to be understood, if you will, and it will change with time. But we don't have any interhuman transmissions right now. Somebody who has symptoms that are compatible with the coronavirus, at the time that we will intensify things, and we'll be calling out to people's judgment as well, because these are powers that we're giving ourselves, but we don't necessarily want to apply. So, and in the sense of the law, a gathering is 2 people. We're never going to arrest 2 people because they've gathered. So there's a judgment to apply. So if there's a homeless person with symptoms, and that we consider that that person could be a source, at a moment when we get to intense epidemiology, we could bring them to the emergency ward first for their own health and the health of others. Why having taken the decision Friday but only announcing it last evening, the decree to forbid gatherings? No, the decree was adopted on Friday evening, but of course it was after the daily press conference. So at the first opportunity, I announced it. So I make 1 press conference per day at 1 p.m. So yesterday at 1 p.m., I announced the decree that had been adopted the previous evening.
André Martin, avez-vous une question?
Oui, j'aimerais avoir des précisions.
I would like to have clarifications. A lot of people are asking themselves questions on to what extent, how much you could broaden the scope of screening tests. For example, the people who live with the people working in the healthcare network, the spouses and boyfriends and girlfriends of nurses, doctors, there are people who call us who are worried, who want to have a test, and for him there's a large delay. Sometimes it's a whole week. But, some people have specific symptoms. We've heard that. Are you going to broaden that possibility? It is clear that we plan on doing so, and if you'll allow me, one thing also has to be understood. There are people without symptoms who also want to be tested. And I just want to specify and bring details. If you don't have symptoms and you are tested and you get a negative, that's false security. So you need symptoms. Now, we have to go to the most important risk, and I can understand. If, for example, we broaden it, usually throughout health, if there's symptoms, even if somebody has not traveled, we do it. And as we evolve in the outbreak of the epidemic in Quebec, the criteria are going to change to go where there's been more impacts. And there were backlogs at the beginning. To give an example, some people were tested but did not at all respond to the criteria for all sorts of reasons. The doctor had done it, etc. Those tests were placed at the very back of the list. They're not high in priority because we had to do the test first. We have to understand that every time there's a case, and there's a case in the family or people are in close contact, at work, in family investigations. So first of all, we put those people in isolation for a 14-day period. If they develop symptoms, they are tested right away. So I don't know if you understand. We go where... But now you tell me that there are people who have not been in contact with anybody, etc., who have symptoms. Well, no, the spouses. But these are categories that we're looking right now to set it up. So we are setting up those elements because we don't want, for infections to be done through the healthcare workers. Could you also broaden the access to daycare to other workers who are essential in the supply chain right now? People who work in grocery stores, truckers who have to continue working. They don't have a choice of being at home. Could they have access to the daycare center? We could do so. We've asked ourselves the question, but for the time being, we don't intend to do it. Why not? Because we believe that it's also important that people who have children be able to continue working, and we really wish to keep that service for the time being to the healthcare staff. A question on the tests and on an element that I talked about yesterday. How many Quebecers? We've been told that there's thousands of Quebecers who are told with the line that they call, "You must be tested." And those people wish to be tested, but they've been waiting for days in order to be able to get the screening test. We've been told that there are thousands of Quebecers in that situation who have no access to the test, whereas they've been told that they must have one. What is the state of this situation? Well, I will start and then I will let Dr. Ruda go on. I asked the question this morning and I was told that these are exceptions, that the people who have symptoms and who have traveled right now, there should be no delay. We have more capacity than we have the number of people asking for tests in that category. So it's exceptions, in my opinion. The information that I have, and we have to be careful, I don't know what is being said because I didn't check every single one of those cases. There are people who say that they want the test, but in fact, they were told that it wasn't necessary. But now you tell me that there would be. So what we're looking at is the situation. Because I'm sure that there are people, I'm convinced, who had a test 2 weeks ago and the result hasn't come out yet because they're in the backlog of the priority number 4, because we knew that they didn't have indications. And probably back then it wasn't an indication. The further we go along this process and in the contamination in Quebec, and that we want to delay by asking people to stay at home, the broader the criteria will become. There's a balance between testing people where it's not indicated, because we know that in that population, some tests may be lost, especially when we're lesser capacity. But now we've increased the capacity to its maximum, and the principle is that if you have symptoms, stay home. But don't forget that, people also have colds and they have the flu, and the vast majority of those people, I'm talking about the vast majority, it won't be that. But we won't take any chances, as I was telling you, as the outbreak gets further in Quebec and we have more, we'll have broader criteria. There are people being hospitalized at the hospital for respiratory ailments. Even if they haven't traveled, we'll test them to know whether they caught it here within the community. So I understand your question. It's being monitored. I'm not the one who's doing it directly. It's another team who takes care of the test, but we are bringing adjustments. And I can tell you that we have a list that's coming up and we are evaluating it. And even sometimes, priorities that were priority 4 will become priority 1. And it's very possible that people who come back from traveling, we won't test them anymore. We'll just consider that if they've come back from traveling, it is a coronavirus. There seems to be a delay between, your speech of we don't want the police officers to go in and the reality. 10 police officers, there were 10 interventions yesterday. People who went to homes. And this morning, people separated runners. So we understand that if a police officer calls because somebody next door is having a party, the police will go. The police is there to monitor and to inform population. It's rare cases where they will use strength. And that's what we have with police officers. We talked with Geneviève Guilbeault this morning, and she is speaking with the different police forces. Right now it has to remain exceptions. We're counting on people's good faith. But I repeat, the decree was adopted on Friday evening, and we announced it Saturday. So, and here in the press conference, as well as a press release. Mr. Arruda, there's been hundreds of Quebecers there will be hundreds of Quebecers who will be coming back on flights in the course of the next hours or days. The federal government has announced organizing that. What are the specific measures that it will be taking for the people who are coming back from countries where there's important outbreaks of coronavirus? Are there going to be specific tests that are going to be done? Any specific follow-up that will be done on those people to ensure, first of all, that they isolate it and that they do it, that they don't go to the groceries store before they isolate? Well, the tests are going to be developed only if they have symptoms. I'm telling you right away, it is useless if they have symptoms and they are coming back from the outside, they're part of category number 1. So there will be tests. Now, it will be voluntary, enforced isolation, because you have to understand that our teams of public health, when they put energy on that, they won't put it in the investigation of the public that has had contact, because when we introduce a virus in a family or a residence, etc., we have to take care of all those who were around, contacts, etc. We have to put our energy there, not necessarily in calling every day people who came back from a trip, but people who are coming back will have very clear guidelines. So voluntary isolation for 14 days. So they have to be careful, and we count on their families to reinforce them. We're not at the stage of denunciation right now. We want people to be aware. We're going to ask them to take their temperature every day, and that if they have any symptom, to not go walk around, but to call the right place to get a test. To my knowledge, and I have to check that with the federal government, they're not being placed in quarantine as we did so in Trenton. That's the information that I got. But I have to tell you, I did not have any personal contact with the federal government in the course of the past 24 hours. But it is clear, at any rate, those are the ones that we're going to know. Everybody has to understand, if you come back from a trip and you feel very good, but you were outside of the country and you may have had in contact with the virus, what you have to do is to remain isolated for a 14-day period at home with your family, especially if you have people who travel with you. Even people who have not traveled with you, take distance with those people within your family. And if you have a symptom, call. It's no time to go contaminate others. You're giving us guidelines every day, but there seems to be confusion in the way that it's interpreted. I'll give you 2 examples. In private nursing homes, there are elderly where we require that they remain in their apartments. They can't even go out to take a walk, whereas they're in full health. Is that the way that this should be interpreted? And another example, in supermarkets, in grocery stores, some people giving service have gloves and others don't. They don't know how to interact with clients. Can we have more details? I think that there are instruments that are produced, and of course, when we have a series of measures like these, like, I've never seen that in Quebec, that we have press conferences every day and that the measures increase and change. So it's normal that there's a certain part of the population, even in the health care network, that are asking themselves questions. So we get that and we try to answer. Okay, gloves. Gloves. It's normal, in the food industry. Some people have gloves, some people don't. Even with gloves, you have to wash your hands. But the issue is the principles of social distancing to the maximum, hand hygiene, etc. As far as nursing homes, for the elderly, right now the deaths that we've seen in Quebec are particularly in the elderly who live in nursing homes. And it's not CHSLDs where the patients are bedridden and don't go out. We have closed down visits from the outside to not contaminate them. These are residences where there are elderly and they can go out and have a walk outside. But if they go to a family party with other people, or if they go gather up with other elderly people in a place, if one person falls ill there and goes back to their home, that becomes a ticking bomb. So we have to judge things. In nursing homes, if there's a cafeteria, for example, we're going to try to organize things so that there's fewer gatherings. Because, if somebody didn't see their child who came back from a trip and got contaminated, that's what the problem is. If you're an elderly person, don't have visitors. It's too bad, but, you can talk to people, people can come and talk to you with a certain distance, but it's no time. Even if it's your birthday and you turned 80 and you've been waiting for your party for years, it's no time to have a party right now by, inviting your neighbors. That's the principle. I would perhaps like to keep going along this vein, Mr. Arruda, because it's obvious that anxiety or stress and questions have been increasing in nursing homes. Sometimes we feel that it's two-tiered. Might you eventually ask that there be security officers? Because now you're closing down malls, but in certain nursing homes, they're still, playing outside or inside, different games such as bocce, or it creates frustrations. Are you going to increase that? Well, we could, but safety depends what we want to do, but we want to make sure that we inform people adequately. Because it's clear that, some people's ears are very closed, but when we're starting to have deaths, people starting to realize that it might be a problem. And yes, and Ms. Blais and the assistant minister will be able to evaluate the situation and give advice. There's still behavior that has to be corrected. We'll make sure that we do so and to give those guidelines adequately to the elderly, whether it's playing beanbags or anything else. And the other element that we should tell you, when we install that kind of measure, there are psychological effects, there's social effects. These are major. So we'd like to ask our intervention teams or our psychosocial to support people so that they understand. Because, when you're old, you're alone, you are stuck somewhere, you don't get it. Perhaps, there's a case of coronavirus in the room next door and you're scared. We have to take care of people. We have to take care of their physical health so they don't catch the disease. Of course, that's a priority, but the mental health aspect as well. And there are psychosocial teams that are going to be developing instruments without necessarily going into the building, but to be able to reassure people. And I would ask the families to collaborate as well, because this is not easy. Both of my parents have died, and I can understand very well, I would have been uncomfortable, but it's a question of life or death. Thank you. And I want to go, I would like to add to what Dr. Arruda has just said on nursing homes. And I'm not just talking about CHSLDs here. It's not ideal that some people continue playing and standing, less than a meter or two away from other people. And I understand that certain residences are worried, and in certain cases, they don't even want to allow people to go walk alone because they're thinking, what happens if they meet somebody else and they catch the virus and they bring that? It would be like a bomb. So I can understand that there are people going further than our guidelines. We ourselves, maybe in the next few days, we might even want to tighten certain guidelines. But I would invite all residences, all nursing homes, to respect that rule, 1 or 2 meters, whether it be inside or outside. And now the question is being asked, we're asking ourselves, should we continue to allow the elderly and to go out at the risk of being contaminated and bringing that back to the home? That is a very legitimate question, and I can understand that in certain nursing homes and residences, they don't allow anybody to go outside anymore. Last question in French. What is the logic behind the fact of closing down non-essential stores in malls but keeping the SAQ open? We did ask ourselves the question. I would not like there to be a rush towards all places where alcohol is sold, including grocery stores. I don't want there to be chaos or a stampede. If we close down, it's possible that we close for a certain time. So we have evaluated, once again, the balance of inconveniences, and we believe that it is preferable to keep the SAQs open. So what I'm saying is we believe that there would be more inconveniences to closing down the SAQ stores. Thank you. Questions in English now.
Maybe because I just forgot to say a few words in English, so I'll do that right now. So as I expected, the number of cases continue to grow, but the actions we're taking since 10 days will start to really pay off in the next few days. But it becomes important to intensify our efforts. So we've decided to extend the closure of kindergarten, schools, colleges, and universities until May 1st. And also at midnight tonight and until May 1st, shopping malls will be closed except for grocery, pharmacy, and SAQ. And for the same period, dining rooms in restaurants, hairdressers, and beauty salons will also be closed. And I ask everybody, again, to respect public health instruction and help our elderly to stay home. I want also to thank Shea Weber and Mrs. Takahashi, who carried messages to our English community since last night. So we must all do our part, and we're all in this together. Thank you.
Merci. First question, Julia Page, CBC News.
Yes, hello. My first question would be for Mr. Roberge. Mr. Roberge, so with school out until at least May 1st, can you tell me what students can expect, especially those who are expecting to graduate this year, and also what the role of teachers is for the next weeks?
Well, they will graduate. Most than 2/3 of the year has been passed, so students were in classes. Parents got already 2 report cards, and we have a lot of evaluation, a lot of marks that allows us to deliver diplomas at the end of the year. If not, we reopen schools at May 4th, if we open it after the 1st of May. But right here, right now, it's important to say to the parents that we will help them. We don't want to transform them into teachers. We won't transform home in schools. We will give them a lot of activities, but those activities won't be mandatory. We will help them to stimulate their kids, to help their kids to learn. And we will do this starting on the 30th of March. And we will add some new activities within the weeks to come.
Avez-vous une autre question?
Encore à moi? Oui, j'en ai plein. Écoute.
Yes, I have all sorts of questions.
To testing kits, can you elaborate a bit more? What do you expect that at any time you'd be able to do blanket testing? Because we understand that some people don't necessarily present those symptoms, but they can be anxious that they have been in contact with someone. So can you tell me if you at one point would be able to do blanket testing and how difficult it would be to even get that equipment in Quebec?
Okay, so at this point, we're only testing people having travel and symptoms. In a next phase, we may test, and we'll probably test other people, but right now, we think that the best strategy is to concentrate on these people. plus people working in hospitals.
Une question de notre collègue Philippe Autier de The Gazette. We saw Quebec City Police intervene to disperse a group. Are you worried about social peace?
I want to be careful. Like I said, we've adopted a bill Friday night at the Minister Conseil. And right now, we count on the good faith of the population. So we want to use police and the force only in very few exceptions in order not to have any kind of chaos in our society.
We are seeing shortages of flour, eggs, and oil in some Montreal stores. Is the food supply still stable?
Yes, we may have some problem because people, they try to have an inventory for many weeks, but so far we don't foresee any shortage for food.
Parliament is being recalled Tuesday in Ottawa. Do you have any specific demands or needs that you hope would come out of those emergency sessions in Ottawa?
But of course, procurements, the critical equipment, we have to continue working together, like we've adopted in our bill, in our decision from the Conseil des ministres. Right now, we don't require any submission. We want to go fast to get some orders from anywhere in the world for masks, for ventilators, and some equipment that we need to be sure we have if this situation is getting worse in the next months.
Une dernière question de Raquel Fletcher qui a été transmise par courriel. The new walking clinic that opens Monday in Montreal is supposed to address concerns about overcrowding. What are the plans for opening other test sites in the city? And will there be other walking and driving clinics?
Okay, first we want to say that this clinic, without any rendezvous, we don't want to have something separate like that. So we are having discussion with this clinic in order that they be integrated in our network. So
Merci.
It's important for people to still call the number before getting a test.
Merci à toutes et
Merci
à tous.
tout le monde.
Bonne fin de
Merci.
journée.
Thank you to everyone.